Hello, everyone. My name is Jehan Ara. I am the founder of the Nest.io, and today we have some exciting people with us. But before we get to them, building a startup is a demanding endeavor in the best of times. Startups encounter a range of challenges: a search for the right product market fit, access to capital, technology choices, the task of building a winning team, etc. Many startups are able to think through these, make informed choices, and execute strategies to grow and flourish. They're able to do this because typically they have good instinct and insight into how to resolve challenges relating to their businesses. This is the time, though, when they say that you have to be a wartime CEO. While the disruption caused by COVID-19 is unprecedented and will likely have some serious economic consequences, there are still startups who are looking at some of the problems as opportunities. And we've invited 4 of them today to talk to us to see what they're doing. So I'm fortunate enough to have with me Saba Khalid, founder and CEO of Aurat Raaj; Syed Abrar, founder and CEO of LiberHealth; Dr. Anam Iqbal, founder and CEO of ABC for Moms; and last but not least, Sibtain Jiwani, founder and CEO of Smartchoice.pk. Hi, everybody. How are you doing? Good to have you with us.
Hello, John.
Hey,
So
John.
I'll ask you. So the first thing, let's get started with maybe you introduce the startups that you started with. Introduce yourself, your startups, what initially motivated you to start the startup, how difficult it has been for you to come this far, and what have been the major challenges. That is a lot of questions in one.
Oh, yeah.
So who'd like to get started? No
I can go
volunteers?
first.
I'll pick on one of
I can
you.
go first. Yeah.
Okay.
So my name is Syed Abrar. I'm the founder of LiberHealth, and at LiberHealth we are on a mission to prevent every death and suffering caused by medical errors due to lack of health information. The idea is connecting biometric data of the patients with the health records, clinical records of the patients. I At this point, a lot of people know why I started this because I bring it up in my pitch too and my talks as well. This initiative has been a very personal one for me, and I've been working on this for the past 6 years. This started when my brother was diagnosed with liver cancer in 2015. We would take him to different hospitals and emergencies, and they would end up overdosing him with different kind of drugs without knowing what was already in his system, which eventually led to his early demise. His internal organs at the end completely gave out. And after he passed away, I researched, I talked to a bunch of people and realized this is not just about Pakistan. This is not just about US or Canada or UAE. It's a global problem. This problem exists in lesser or greater extent in all the countries around the world. So we said, yeah, we should fix. There should be a solution for this, and that's how we started. I first named the company Azad Health. That's when we got incubated in Nest.io. Nest.io, Jahan was the first person to believe in what we're doing, and after that, we started working on this. We iterated, built a patient portal. We researched new technology, and we were coming from the tech side. We had no idea about how healthcare worked, and that was one of the challenges. And there's so much red tape around healthcare and health data. There are so many data silos that people don't want to share health information per se. And when we started working on, we realized, yeah, we need to do something about it. We need to build a trustless system between all these stakeholders, and that's how blockchain came into view. We started working on building a distributed ledger system among all these healthcare stakeholders. That's how we got to this point. Now we have something which can be used by organizations. Yeah,
That's great. You have put this very briefly, and yet we know a lot more about what you did and why you did it. Next, Sabah, would you like to get started? Your mic is off.
Hi everyone, sorry you didn't hear me. So I work at Aurat Raaj in Karachi, and the reason why I started my work was very simply about the status of women in Pakistan. At the time that I started, I had absolutely no idea what my solution would be. The only thing that I brought with me was passion about wanting to change what was going on. And at the time that I started, there were certain cases that were so alarming, one of them being Kandil Baloch's case, and a lot of other child abuse cases that made it very, very important for us to use technology in a way to bring advocacy for change and policy change more specifically. But during this time, I think I became what's called like the queen of pivoting, because every time I tried an approach, I would see its challenges and I would have no choice but to change my approach. So at the time that I joined the Nest 3 years ago, I came up with this idea. I'm going to write a blog and I'm going to write about all of these things. I would write them in English. A handful of people would read it. They would be like, yes, very good. But at the same time, that would not lead to any real-time change. So then I came up with this idea that we would do a cartoon series and we would highlight a lot of taboo topics. And then we realized that beyond people who had digital access, the people who were not included in this particular digital transformation, they were missing out on this content, and they needed that content or that empowerment or that education or that health education the most. So then I thought, okay, we're going to take all of this content and then we take it into classrooms and we're going to give it there. Realized that the classrooms were not equipped with a lot of the technology. And then a lot of the girls also had so many questions after they would see the cartoons that we had no choice but to create something else. And so then we created our chatbot finally, and that we thought, oh, we're sold. Now this is the best way for us to have a conversation with girls. Realize that even with chatbots, there is so many challenges. There's a lack of empathy sometimes. There's a lot of, sometimes a chatbot actually does more inaccurate information, leading to more problems for the girls that we wanted to impact. So I think 2020 was the time when I had finally access to capital. I had figured out my distribution model, which was schools. I had a killer team. I had people who were really, really passionate about working with our group. I had mentors. And then suddenly, like, everything changed for us. Like the channel schools closed down. And it was when I heard the first time that 2 weeks schools would be closed, I had already predicted that they're going to be closed for the rest of the year. So, so for us, it's been such a huge turnaround. Like we went through all the challenges just to face a whole new challenge. But at the same time, I think this is also a great time for social innovation. So anybody who is passionate about social change, and especially with the changes that are happening with gender, I think our work is going to continue to be important, and we will take different directions, but it's not going to fade out or just completely go away.
So you're the queen of pivoting. I think there's nothing wrong with pivoting, because, you know, you learn something from each pivot. And then you finally, just like you said, you finally got to a stage where you knew how it would all come together, right? And now you have to pivot again. So we'll talk about that later. Sibtain, would you like to tune in now and tell us your story?
Sure. Assalamu alaikum, everyone. Thank you, Jahan, for having me on this panel. So let me tell you what Smart Choice is. So we are an insurance marketplace for individuals and businesses, so they can compare insurance policies online and buy them instantly. Well, again, I was part of the Nest IO when it also, I think it was its first batch when it started. So I went through a journey, a difficult one, a challenging one, and Jahan has been throughout this journey with me, helping us out, advising us, giving us direction. We initially started with broadband comparison, though the vision was much bigger, that we wanted to become a financial supermarket. So that supermarket would have all kinds of comparison, from mutual funds to insurance to credit card, loans, broadband, and a lot of other things. Initially, we started with an MVP with the broadband thing. Then we moved towards banking. We moved towards insurance. But later we realized that we're trying to do too many things, and we are not able to scale it to a point where this could become a sustainable business, or a business where we can really create a larger impact that we wanted to, apart from just making money. So eventually then later we decided about a couple of years back that we just want to focus on insurance, because it has a much bigger impact in terms of because it gives a lot of financial protection it is actually works as an equalizer in the society, where a person who's not able to protect himself because or does not have enough savings can actually buy insurance and get a protection for his family. And there's a lot of other ways we can support the community as well by launching a few programs where the person who can afford it can actually gift the policy to someone else or can actually afford the policy for someone else. So so insurance is what we do right now today. And we have about 15 insurance companies we work with today. We have impacted more than 25,000 lives since we've started since we've started focusing on insurance only. And so we do range of products from car insurance to health to travel insurance, and life insurance as well. So, yeah.
Okay, so see, he also pivoted and found the niche that you wanted, and that was going to get you the most traction and give you the most, create the most impact for people in Pakistan, right? Are you restricted to Pakistan, right, Sibtain, for the moment?
Yes, we are. We've looked at other markets, but I think we were going to take a decision about a few months back to go to another market, but I think that was the right thing not to do.
Yeah, better put that
Looking at
on
the
hold
current
for the
situation.
moment.
Yeah.
Yeah, just a side note. I love Smart Choice. Like it has helped
there
me
you
a
go.
lot for travel insurance. Like I could get insurance in like less than 24 hours. It was amazing. Like all these travel in the past year has been because of Smart Choice. It has a lot of
Appreciate
like
it.
eligibility criteria for traveling for these events. I have fulfilled them because of them. Yeah.
There
Thank
you
you.
go, a
Thank you
fan.
so much.
Me
Thank you.
too. I use Smart Choice as well.
Thank you.
So, Dr. Anam, last but not least, let's hear where ABC for Moms, why did it come about, and what is the mission behind ABC for Moms?
So, Assalamu alaikum, everyone. So, I'm Dr. Anam Daim. I'm the founder of ABC for Moms, or After Birth Care for Moms. So, it's a digital health platform which is exclusively for mothers. For the time being, we are constantly being asked by dads also, why aren't they included? But for the time being, we're working on maternal and child care. And our mission is to improve the infant and maternal health metrics in Pakistan, because there's a huge gap in this area in Pakistan. Um, and we want postnatal care, that is care after giving birth, accessible to all women across Pakistan, while keeping it convenient and relevant also, because there's a lot of irrelevant and non-expert advice that is circulating around. We want to have a presence where only experts are supposed to give advice to new mothers and the children. So the motivation comes around with me being a doctor as well as a mother. When I became a mother, even though I was a doctor, but there was this huge challenge that I faced, was that a lack of explanation and discussion that I came across from consultants, pediatricians, gynecologists. Probably they don't have enough time to cater to every patient, but that's the area that I saw was there was a lot of improvement that's to be needed there. But at the same time, as a doctor, I did figure that there's a lot of doctors who are willing to contribute to the community, but they need a proper portal through which they can connect with mothers and they can provide them proper and accurate guidance. So that's how it came about. We also started off as a preventive healthcare startup at IVA, and we pivoted it and became a maternal and child care startup. We started off with three different categories, and we saw a large scope in a huge gap that was present in the maternal and child healthcare in Pakistan. So we pivoted towards that. The major challenge that I faced was being a doctor, we are supposed to join the conventional fields. We are supposed to go towards clinicals and stuff. So that was the hard part, not actually convincing. I wanted to do it, so I started off with it. But I still have to convince people that yes, I'm a doctor and I have a startup, and then I have to explain to them what a startup is. and why was I going to Nest.io, and why I'm using a tech, why I'm learning tech, and why I'm using that platform. So that's the major challenge. And one other challenge is the lack of awareness that is present in the general population. So especially the families, not just the mothers do realize that there's need, but the families do not actually have enough awareness of the issues that are present in about the maternal and child health. And these issues are highly preventable, but some of these issues and health issues are actually fatal to the mother. So that's what we're working on. Awareness is one of the key parts of the startup. The key awareness and marketing is done in this on this side. Yeah, so that's about it.
Okay, great. So certainly an area that needs a lot of awareness, and I think that the mission is a great one. So don't let anyone tell you that it shouldn't be done. I think there are a lot of naysayers who tell startup founders, hey, ye nahi ho sakta, but ho sakta hai. Let me at least try. Okay, so now
I'd
to
like
get
to add
to
just one thing, that I recently, when we are growing, I come to realize that it's been a blessing for me, because in this way I can practice like professionally as a doctor as well, and I can utilize my skills as an entrepreneur as well. So that's something I really find myself fortunate to be into this field.
That's terrific. Now let's get to the coronavirus. How have each of your startups, have you pivoted in the past couple of months? Did the coronavirus steer you into reevaluating your journey and innovating your product offerings? So, Abrar, like to begin?
Yes, absolutely. So the idea has always been combining biometrics with the actual data. Like imagine a global digital identity, which is not based on your ID cards, which is not based on your passport number, but the actual characteristics of the person, like their fingerprints, their facial, their eye scan, that kind of stuff. And you carry that with you everywhere, no matter where you were going, and be able to identify you with those characteristics. So what we started doing was we implemented fingerprint scanning and facial scan to identify the patient and get the medical records. We built that up and in the early 2020, and we were going around showcasing it. Then Corona hit, and we realized that the fingerprint has been suspended because it spreads the contagion due to physical contact. So it's basically provides you have to have physical contact with it, and the facial scans are being compromised because of the face masks. So even if you're outside, you want to unlock your phone, you have to take off your face mask and you look at the phone just to unlock it. So then we realized, no, there has to be a better way to do this. And we already worked on the pattern for the fingerprint and facial. We did all of that. Now we're in a new space, and now we get the news that Punjab hospital has suspended the use of biometric fingerprint attendance in the hospitals, and we getting news from other organizations that they've suspended the use of fingerprint scanning. And we realized, yeah, there has to be a better way to do this. Why don't we use iris scanning? And use the eye, which is more unique, which is less prone to getting damaged when you're in any kind of car crash or an accident, because it's the face which gets the impact, or your hands or other parts. Eyes are less impacted by that. So we started working on that part, and we then pivoted the idea around that. Now we're building the product, the new product from scratch for iris recognition, which will essentially, we're hoping is to be a de facto alternative to the fingerprint scanning and attendance systems in hospitals and offices and all these other organizations.
Yeah, great. I mean, yes, it's a great opportunity, and it's good that you saw it long before it was needed. Saba, did you find an area, your mic is still off, did you find an area where you could help during these challenging times of, where the corona is sort of scared a lot of people, there's a lot of misinformation, how and what is Aurat Raaj doing to sort of fill the gap here?
Yeah, the first thing that happened, I have to admit that I wasn't in the pivot mood at all. I think I spent at least 1 to 2 weeks anxiety ridden, because there was so much of all my planning for the rest of the year completely like change around. So I wasn't one of those I saw a lot of entrepreneurs from the nest so beautifully pivot, and they had like literally within hours a plan to provide free services. They had changed their platforms, they had the right information available. So I was a little bit scared and I took my time. But I realized that there was a lot of need for research at this time, and especially of advocating for all of those girls whose voices are not going to be heard and the problems not being heard at all. One of the first problems that was highlighted by my audience was that they had no access to menstrual products. And our work is centered around menstrual hygiene and making sure that girls are able to manage their periods with dignity. And now the supply chains were affected. A lot of girls couldn't go out and get the product. And even the startups that are working in this domain, they were not considered essential services. So they couldn't even provide these products at home. So we started doing a lot of advocacy. We started writing blogs, we started writing about it and making sure that, we got the voices of those girls heard. This also made me realize that, these product access problems, these domestic abuse issues, which are going to be secondary effects of COVID, how do we highlight them? So we came up with this data mapping solution. So we're trying to map out all the secondary effects on women and girls as part of COVID that's happening. And if we don't kind of map this out, how will we recover from COVID? So this is more in that aspect. And so the 3 years that I built on being social, I had to kind of go back and become more introspective again, start writing again. We're using social media to kind of share this information as much as we can. Another thing that we did was we already had the technology in place to have a chatbot. So we built a chatbot specifically for lady health workers and community leaders. And we are starting to train in Orangi how the lady health workers can actually get updated information about COVID and how it impacts women and girls and take it into their communities. But even with that, we quickly found there were challenges. So when we trained them and they took it in their communities, they had to practice social distancing. We had to make sure that they had masks that they were wearing when they were carrying out these interventions. So there was like other things to consider when doing these community interventions altogether. So now we've got the bot in place, we're working on the map, and the third thing that we're doing is all the research and publishing and advocacy, writing. That's going to be our core.
Isn't it strange that what is considered essential services, just because you are not involved in that particular area, as a policymaker, you may not think of it. It's not intentional, but it's just lack of knowledge. So I'm glad that you're focusing on that. I've seen you using Instagram a lot, and the posts that go up are very simple so that people are aware and get the message without having to, go through loads of text and all of that. So good job there. Sibtain, so how is the insurance, how are you using insurance to help with the Corona challenge?
Well, I'll tell you what happened initially. So when it happened, I actually did not consider this to go that long, like this lockdown to go for this long. So I initially thought it'll be just a 2 weeks downtime and we'll be up again, and we'll be back again focusing on things. But then after looking for a week and so 10 days, I think, and looking at other startups, what they were doing, what the analysts were saying, what the media was saying, the reality kicked in. But by that time, what was happening was because see, insurance is a product which actually you buy it for uncertainty. So this uncertainty is actually an opportunity for us to raise more awareness among the consumers about insurance. That is what we've been doing. So one of the things that we are doing continuously now is raising more awareness about health insurance, especially because now more people are concerned about health. They are more reading stuff about how they can protect themselves against this pandemic, how they can actually take precautionary measures. and they are being more worried about it as they were never before. And they also realize that it's not just about having insurance. It's about they shouldn't get ill, because if they get ill, the hospitals are actually not ready now to take these patients and look after them, because they're also scared. They are understaffed. So that is one of the things that we did, was to raise awareness about, specifically about health insurance among individuals. And also we are targeting now businesses. So businesses which are small businesses who actually have small employee base, like 10 employees or 30-40 employees. They usually do not have health insurance for their employees as yet. And they are usually adding up these benefits like annual leaves and PF, and then they think about health insurance. So we made it very easy for them in this situation how to really get health insurance. And we spoke to our insurance partners, and they were very supportive, that they were working from home. They were giving us all the support that we needed to bring on board these small businesses, so that their employees can be insured and they can feel protected. So and employees also felt that it is their responsibility in this situation to protect their employees, and not just just shift all the responsibility towards the employee, because employee is actually investing a lot by working from home, because he's spending on his own electricity, on his time, on space and everything. So employers realize that they should be taking care of their employees. So this health insurance really is a tool that we made it easier for them to have. So that is one of the things, that is another thing that we did. And the third thing that we were already working on in the past, which was we didn't see this coming, but we were already working on, was to make insurance affordable. So for that, we are actually we are going to launch a product which will allow consumers to buy insurance on an installment plan. So for 3 months, 6 months, 9 months, 12 months, they will be able to buy the insurance, because currently today you have to pay for the insurance premium upfront. So if you're getting a health insurance for the entire year for a family, it would cost you somewhere around 20-25,000. What if you could break it down to 2,000 rupees a month? More people would be able to get it. More people would be able to use this facility. So we are soon going to launch that. So I think this whole thing actually gave us the opportunity to take a step back, look at our priorities, and really plan for it once things go back to not completely normal, but at least resume where people can actually go back to their daily lives.
You're right. I mean, health insurance is something that especially small companies don't think of, because it's just, they consider it an added cost. But now I think people are starting to take it more seriously. And I think the affordable plan that you just mentioned, that's just great, because a lot of people individually may then be able to afford it, even if their employers are not
Yeah.
looking at it. So that's great. Um,
Yeah.
Anam, so how did you pivot? What were the kind of things that you started doing? Are you still focusing on the mothers and infants? And what are the additional things that ABC for Moms started to do because of the coronavirus?
Yeah, so since the very beginning, when we launched, we teleconsultations was a key component that we had to launch. But unfortunately, due to one circumstances or the other, and as I did not have a tech background, we weren't able to launch it. And a lot of my colleagues do know that I tried to get a lot of guidance and mentoring on how to start it. So as soon as the lockdown began, I got in touch with a lot of teleconsultation startups and teleconsultation and telemedicine startups, and one of them was very kind to initiate it with us very just within a few hours. Just like Saba said, we were able to launch free teleconsultation within a few hours, and we a lot of doctors volunteered. We have 25 doctors on board who volunteer from 9 a.m. to 9 p.m. An hour or two of their time, and we've been able to provide 230 plus health consultations, and every day we have a lot of consultations being provided. um, Secondly, we started working a lot on evidence-based content. we started reading a lot of researches. We had a content writer on board who was from a medical background, who could read researches and provide evidence-based articles to our viewers and our readers. Um, so yeah, the teleconsultation portal is currently being provided for anyone who needs it. So we offered it for the general population, but most of the traffic that comes in is mothers who are concerned about the child's health, or just regular complaints like only today a mother got a consultation because the child got hurt in the eye because of a glass piece or something. So we had an ophthalmologist on board, and she gave a proper consultation, and this way she wasn't exposed to the disease, obviously. um yep.
Okay, there are questions starting to come in, so I'm going to use some of those before I go back to my own questions. Mohammad Zubair wants to know, do you guys face payroll problems? If yes, how are you dealing with it? I guess he has a startup as well. Who wants to take that?
I can take it. So yes, it is definitely because cash flows are really hurt. No doubt about that. Obviously, potential business or the way it was growing, because we were growing at a good pace month on month, and that has obviously slowed down quite a lot. So that did impact. But I must tell you that my team was. I actually sat down with my team, with my core team, and discussed this issue. That how can we solve this problem of payroll, and because this is going to become a huge problem if we are not there after 2 months, 3 months, there is then whatever we do today does not mean anything. So how could we solve this problem? And I must tell you that they came forward to agreeing to some pay cuts, where they voluntarily agreed to that. And I think it only works when you have a great team you've put together, and that was a time when I realized that I've really put together a great team who really has a buy-in into this problem, who wants to solve a problem, who wants to make an impact. And that really helped us in solving at least some of the payroll problem. And the other thing that we did was we dig deeper in towards our receivables, where they were stuck. We actually streamlined that by talking to our partners to release those payments as quickly as they could. We are also exploring the option of State Bank, which has really has come up with, which has been revised multiple times. But I think we are also evaluating that, because right now this is the time to actually pass through this phase the way whatever we could do. And we've also reduced our office expenses, and obviously Ramzan, चाय का खर्चा कम हो गया, बाकी छोटी मोटी चीजें कम हो गई है. Because I'm going to office, we are maintaining social distance. Not all the staff is coming, only 6-7 staff is coming. The remaining staff are working from home. So the electricity bills have gone down and all that. So that everything I looked at, I took stock of all the expenses and see where I could cut it down. And we've then alternate products that we've started working on, alternate revenue streams that we've built in. We believe that will, that has already started generating revenue, but in 1 or 2 months that would be it for us to allow us to get past through this phase much in a much better way. So yeah, these are the multiple things that you could do.
No, you have to. As an entrepreneur, you have to juggle and see how you can cut costs and yet not be unfair to your employees. And it's good if you have a team who temporarily takes a pay cut. Anybody else wants to add to this question, or should we move on? Okay. All right, let's move on. So, Saba, so you said earlier just now that, social innovation is something that everybody should be looking at. Can you highlight some of the opportunities that are available for startups in the social sector right now? And do you think the funding options that are available or that were available earlier will begin to decline? Or do you see, as if it's going to be maintained or it's going to increase? Since you have so much experience in the social space, it'd be great for those startups that are actually also in the social space or looking at getting into it.
Absolutely yes and no. So in terms of funding, grants and other things are going to continue. I think social innovators are going to have more competitions and more prizes and more, we're all going to be concentrating on that COVID related social innovation. But at the same time, I think a lot of at least our revenue streams or potential revenue streams were all based on CSR funding from corporates. And now a lot of them are rethinking their CSR funds, they're rethinking their marketing funds. So that aspect might be affected. But there are clear areas where the social innovation funding will go to. So education, health, and then the gendered implications that I spoke about. So girls and women are going to be the core criteria for a lot of funding. I also was thinking about, how the funding will be divided. So a lot of funding is right now going either into identification of COVID in patients, others is going into dealing with the current problem, all the pandemic related problems. Then they're also funding the pivots that we're taking or how we can successfully pivot, which is a lot of emergency funding that a lot of foundations are giving to past alumni or past cohort members. And then the last is the recovery that I spoke about, that how do we come back? So there's a lot of funding in the future that's going to be for that area. I think one thing that I would really want to highlight is if you've got like 6 months, let's say, of sitting at home, put it into an accelerator, put it into an incubator. Now you can sit from home. You don't have to like go to San Francisco to attend an incubator accelerator. They're opening up their programs for more international startups. So take advantage of that, not only because of the learning, but also a lot of them come with investment or they come with funding. And this is something that you have to right now, everyone has to put on their fundraising hat. I would say for the next 2 months, because budgets are going to close, people will reassess and think differently about how they spend their money. So I would say that do the impact work, but also think about how you're going to sustain yourselves 6 months, year, 2 years from now, because funding priorities will change. And also, I mean, I just want to say that whatever innovation you do, kind of think about all the discluded communities because they will require our innovation the most.
Great. Abrar, so, you travel a lot and now your wings have been clipped and you are stuck here. How is that affecting your work internationally? Are there things that you can do from here during the lockdown while you're not traveling, carry on with your work, or have you had to change some of the ways in which you're doing, the work for LiberHealth?
Yeah, the work has definitely slowed down because of the quarantine and the restriction on travel. But in retrospect, it's like we already had that problem since we are here and our market is in UAE or the North American market. But even in that case, the 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 response from these organizations have increased. Like they are, like YC is now focused on more on COVID, and there are other accelerators who are prioritizing COVID applications more. Like Saba said about the attending the incubator or the accelerator remotely. I recently applied to New York Health Challenge, which is promoting health equity, and we align perfectly with their sort of like their priorities. And one of the requirements for the program was I had to be in New York for in June or July for the boot camp. And then they said, no, you don't have to do that anymore. You don't have to spend any of that. You just have to come online and we can do that virtually. Like, yeah, fantastic. Just apply to it. So that kind of stuff has helped a lot. At the same time, the investment part and the people I was already talking to, they have a little bit slowed down because the other startups are struggling right now. They have to put money in on the investment they have already made so that they can help them pivot. And they said, yeah, we're gonna come back to you, but it's gonna take some time. So it's as things settle down and we get a clearer picture of what's happening, we're gonna do that. Also, there's going to be a lot of investment in the post-pandemic. Like now people are beginning to realize, organizations are beginning to realize that this is not, I hope this is the last pandemic, but indications are this is not going to be. We need to be prepared for the next one, and we need to have, we are very, as a society, we are very fragile in actually maintaining our daily routines, and we need to have those measures in place for the next pandemic that we have already, be prepared to actually go about facing it.
So you're right. Actually, healthcare, education, as Saba also mentioned, these are the two areas that everybody's going to focus on right now.
Yeah, that's the
Because
future.
yeah, and if anything good could come out of this, it's that people have realized the importance of digital and being able to do as much remotely as they can. So I think there a lot of the startups will benefit. Uh, Sibtain, there's a question, another question for you, which is from Abdul Ghani, who wants to know, is health insurance really affordable for the middle class? And why do we know so little of what it offers?
Okay, great question. Thank you, Abdul Ghani, for that. There are two parts to this question. One is why does he know very little about it, and the other one is about the affordability. So I'll tell you why you don't know about it, because insurance companies do not tell you about it. They do not market this product as much to individuals. They market it actually to corporate customers, to companies, and they also go after bigger companies which have a bigger employee base. And they do not like to talk to smaller SMEs or individuals because of the margins, because of the acquisition that it takes, because of the way they always approach to sell insurance or to explain insurance actually. So which has been pretty outdated for long. And so that is why you do not know about it. Also, there were not enough options out there, I'll be honest with you. Only one or two companies were offering individual insurance for families, or one person who wants to buy insurance for himself. But in the last couple of years, I would say about 18 to 24 months, actually, more companies realize that they have to enter to this segment of health insurance, because uh, uh, other segments and other products are actually, they have their own limitation in terms of scale. Where it comes to health insurance, it has a great appeal to the masses, and it makes a lot of sense because of the increased healthcare costs, because of the number of diseases that are already there. Because though we know about COVID, but there's dengue, there is a lot of other diseases which are specific to Pakistan, which has increased in the last few years. So that is why now insurance companies have realized this thing, and but again, they are still not doing enough to market that. And but we are doing our part as much as we can to raise awareness about it and get the word out. Secondly, why is it affordable? It is not affordable. Well, see, it's for an individual, it costs about anywhere between 4,000 to 12,000 rupees a year to afford a health insurance which would give a coverage of about 3 lakhs to 5 lakh rupees of hospitalization. Now that's a decent cover for a decent amount of money, right? You do not we spend, if you go out to eat at a good restaurant, we would be spending about 2 3 people, 4 people, we would spend about 7 8,000 rupees, right, per dinner. So in that sense, for a middle class, it's definitely affordable. It's And for families, it's in the range of 15 to 25,000 rupees. Again, if you break it down for 12 months period, it is only 2,000 rupees. The only challenge is that you have to pay that amount upfront. But again, we spend a lot of money on other things. It's all about the understanding of, it's the financial literacy. It's about your priorities. If you can prioritize your thing, you wouldn't mind spending money on this thing, and be a better planner for a downward situation. So it's I think affordability is not a bigger challenge for the middle class. Definitely, it is not. I don't see it. The bigger challenge is knowing about the product. It's about whether what it covers, what it doesn't cover. How do I make a claim? Whether can I buy it for myself? Can I buy it for someone else? What will happen next year? What will happen about my existing disease? What if I have an existing disease? Will it be covered or not? So there are a lot of other questions which actually keeps the customer away from this product as compared to the pricing part, I think so. And this is what we felt, because you won't believe customers have bought policies worth 100,000 rupees from our platform paying through their credit cards. And it's a fact. I'm not making it up. And people have paid 40,000, 50,000. They spend money on insurance, on health insurance, especially quite a lot of money. But it's only about your priority. If you understand the need of the product and whether how much does it solve your problem, how much can it solve your problem in terms of if something goes wrong. So yeah.
Anam, so you spoke about the teleconsultations as far as COVID is concerned, but do you feel that there isn't enough guidance being provided to expecting mothers during this period, because everybody's focus is now on COVID and Corona? And is the disease, does a mother actually know how to protect herself and her child from Corona or any other disease during this period? Is that something you're working on as well?
Yeah, so the answer would be same for the general public as well as expecting mothers or recently delivered mothers. There's a lot of lack of awareness. There's a lot of lack of information, not just about coronavirus. Everyone knows what coronavirus is now. Everyone is talking about symptoms, what coronavirus is, what's the mortality rate and stuff. What we are not talking about is what if we get symptoms? What are we supposed to do then? What are the facilities that we are supposed to go to? If we are talking about mothers, they do not know if they're supposed to go for routine checkups or not. There was this mother who was also a general physician, who was a doctor. She wasn't a specialist, but she was from a very well-known facility. She was sent back because she had breathlessness, and this was towards the third trimester, during the end of the term. And it could have been something very, very critical and an emergency that should have been treated, but the mother was diverted immediately back to her home because she was having shortness of breath. She wasn't having any fever nor any cough. She just had breathlessness. And the consultant, she asked her to go and get the coronavirus test done. So she contacted us, and then we were able to, with her and the gynecologist, we were able to connect them, and we were able to make her evaluate her symptoms and observe, and then rule out other possibly more major illnesses. And then she got the corona test. That was also a struggle because she did not know where to go. She did not know what precautions to take. She was a doctor. She was very anxious, but still she was unaware what's the best place to go for a test to be able to stay away and not be exposed in this certain situation. So we guided her to that. We had to arrange from a proper reference, we had to arrange a test to be done for her. But what about the general public? What about people who are probably not going to get in touch with us personally? People get symptoms, they do not know where to go. They go to hospitals, they are diverted back. They're not taken in. Even for regular illnesses, there was this patient who is on dialysis, and she was not taken in at Tabba or Kidney Center. She got in touch with me. I did talk to someone at SIUT. She was then properly guided, unless she didn't know what to do because she had to get dialysis done. She had fever, and that was the reason that she wasn't being taken in by any health facility. So at SIUT, the corona test was done. She wasn't properly guided that she needs a corona test done in order to get admitted to a critical care facility. We told her to do that. She got it done. She was negative. Only then Tabba Kidney Center, they took her up and she was able to get dialysis done. So the fever wasn't due to corona, but obviously all the anxiety and all the uncertainty that's around. The doctors are also not at fault because they do not supply enough PPEs, enough masks. At ABC for Moms, we've also created a group which has all the doctors, and we connect them to suppliers and distributors to be able to get them the lowest prices, because the hospitals are not supplying any most hospitals are not supplying any PPEs or masks. They just give a certain number, and that is also charged from the doctor, and that's what they receive for the whole month. So they have to arrange themselves. The patient is also not at fault.
Yeah, no, nobody's at fault. I think we're all trying to deal with it, and we're all trying to figure things out. So I don't think the blame game doesn't work. You need to all work together. So there's a question here from Azib from MedAngle. He says this question is for Saba and Dr. Anam. The World Health Organization recently said that we're expecting a record amount of births coming in 9 months, 5 million plus. How do you guys feel about the burden or impact this will have on Pakistan? And what, in your opinion, is a hurdle in further promoting education regarding pregnancy, antenatal care, and women's health?
Yeah.
Sabah, you
So
start and then Anam can continue.
Sure, go ahead.
No. Sabah, your mic is off.
Yeah. I was saying that's such a great question and something that we all have to think about. And I was thinking about the burden and who's going to bear the burden or who's going to innovate to actually provide the services to these new mothers and the births that will happen. And we know that the government right now will not be able to manage that. So I feel that they're going to be like a huge burst of femtech startups or women starting their own technology related businesses. But the hurdle that you said, the additional hurdle that will come is that we still don't fund our women businesses. We still don't fund our femtech startups. So that is where we need to kind of change our approach. The other hurdle that I feel that will happen is that even if they build amazing businesses, technology access to these new mothers sometimes is not there. So we also have to make sure that there's enough internet penetration, there's digital inclusion, so that these excluded mothers are able to access the information or the services that these femtech startups are building. I was kind of doing the mapping and realizing I've been in reproductive health for the last 2 years now. And in this 2 years, the same startups have continued to evolve or be. There are not enough new startups coming in. And that is why I keep saying to women that we have to kind of solve our problems ourselves. Nobody else is going to come and solve them for us. And we know our problems the best as well. So I would say that, women have to step up and start preparing for this particular repercussion of COVID.
Anam, do you want to add something to this?
Yeah, so Pakistan already has a 3.79 lakh per month. Yeah. Yes, that's a high rate already. So as Saba said, we do need to see what's the internet penetrations. 58% population in Pakistan do not have access to internet and the smartphones. So this is where the government has to come in and play their role. In my opinion, we have to have teams which has health workers, lady health workers who are properly trained, who are trained on social distancing as well, who are trained what to guide mothers, and we try to work on it. But obviously when this needs the involvement of the government, we can't make a team and roll it out like that. We need to have the government on board for that. So we did try to start that, because most mothers, only 10% mothers, even up till now, 10% mothers got postpartum care, the care after giving birth. So now I fear even lesser, even one person won't go to a hospital or a facility due to fear and anxiety and fear of getting corona. So this is something that needs to be catered at the government level. I think there should be public-private partnerships. I think they should make teams in collaboration with startups, with private companies, and the government needs, apart from the tech-based stuff that they're doing, the government needs to have more focus on the crucial on-ground activities that are being done, because there's no data that's been provided of availability of beds. Recently, we saw what happened to Dr. Farhan. There's another hematologist who was at Expo Center but couldn't get a ventilator or he also got a reference and then got admitted at Indus Hospital. So this is something that is lacking in on part of the government as well, and this is something that only the government can do. obviously जो optimization and quality assurance है, ये सब कुछ है, जो data है, that could only be provided by the government. So I think this is something that the government really needs to work on, apart from the tech innovations and stuff that they're doing. This is something that needs a lot of concentration on.
Okay, so that was going to be my next question anyways. So Abrar and Sibtain, if you can also join in and tell me what kind of help do entrepreneurs who are trying to actually help during this crisis, what kind of support do you need from the government? How can they help? Maybe they don't know. I mean, whether it is in terms of, they've been helping SMEs in providing payroll, there is data, as Anam said, that we need access to if we're going to help anyone. What else do you think the government needs to do? What would you like to see them do that they're not doing yet? And this is for all of you.
Right. I'll just take this question. So first, I think one of the few steps that SECP took, which was very great to see, was they asked insurance companies to extend car insurance for free for 1 month because of this corona thing. So actually consumers got 1 month of free insurance. If they already had insurance, they got 1 month of free insurance for their car insurance, which was really good because nobody was using their cars. There was very little movement on the roads. So that means less claims. That means less administration of the insurance companies. So I think they have already started doing that. Other thing which also SECP did was when multiple insurance companies approached them to launch a new insurance product for COVID-19, specific coverage for COVID-19. SECP really jumped on this and approved the product very quickly, and now it is available with us on our platform on Smartchoice.pk. You can buy an insurance plan for COVID-19 only for your family, which includes your parents as well. And we are launching one other product with another insurance company. So they have taken a few initiatives which I really like, that they are proactive about it, and they're supporting the industry when it comes to protection for the consumers, especially in the insurance industry. One of the things which I would like to see more is government start focusing more on how to make insurance as a main thing, because it actually allows everyone to get access to better healthcare. And one of the things which I think they could do is to make it somehow mandatory for companies to buy health insurance for their employees. Middle East has done it. In Middle East, Dubai has done it. Oman is doing it this year. And other countries in the world actually have this in place, because it actually becomes a responsibility for the employer, and it is not a lot of cost, to be honest with you, and it is a great retention tool for business as well. So if SECP could enforce it, because through somehow for a smaller companies, let's say make a minimum criteria that if you have 50 employees, you must have insurance for your employees. I'm not saying to enforce it on startups which are just young, which have other expenses to cover, but at least make it mandatory for businesses which reach a certain size or revenue or volume. And so that would be a really game changer for the industry, for the consumers, and in terms of protection for the consumers.
So like pensions and all of that come with an employment contract. But SECP has been on the ball. They've been very quick to respond to a lot of things, and it's great to see. Anybody else wants to add? What would you expect from the government? Is there something, Saba, Abrar, Anam, that you would like to see the government do right now, which would support startups across the board, and also which would help people so that they can access the services that you're offering?
Okay, so as I mentioned, we had a proper, we had planned how maternal care teams can be made.
I'm just gonna.
Okay, let Abrar go ahead.
Yes, Abrar.
Yeah, I'm gonna just piggyback on what Sibtain said.
Okay, go ahead.
Was that on mute? No, go on.
Go ahead, Abrar.
Yeah,
Anam will follow.
so just gonna piggyback on what Sibtain said. The government should have this in place that when a company reaches a certain uh,
Anam, he's disappeared. So you might as well, I think his line has dropped. So why don't you continue what you were saying and then we will take him back on.
Okay, yeah. So as I mentioned, we had planned proper maternal and child care teams that could be developed in the face of the current pandemic. I think the government should utilize the current force that they already have hired.
Okay, Abrar, are you back? No. All right, let's
yeah, what
continue.
happened? Was it just me? Oh.
Yeah, you stopped. I think you dropped off. Can you continue? You were going to piggyback off what Sibtain had said.
Yeah, I was saying that government should enforce this, that when a company or a startup reaches a certain amount of revenue, they should have health insurance for the employees, and that's where the first part about your insurance on installments could come in handy for these smaller organizations. That they can buy insurance for the employer, but they don't have to pay upfront, and they can pay for that over time. Another thing I wanted to point out was the government should try to at least subsidize the utilities like electricity bills and the water bills and that kind of stuff. They cannot be waived off. That's going to be really difficult. But say be postponed to a certain time, or it may be defaulted to a later date. Like if you have a bill of like 10,000, you can charge like 2,000, and then the rest amount gets billed over the next few months. Make it
So the
easier for
government
them.
had said that the electricity bill can be paid in installments. And I think as far as the rentals are concerned, a number of landlords are uh, giving discounts on the rent. You know, our landlord has agreed to a 50% discount on the rent because they know that we are not using the space. But yeah, if the government could help, because not all landlords are going to, um,
Yeah.
comply. So if the government can help to subsidize the rent, the payroll, the electricity, that would really help a lot of
Yeah.
young startups to
Another
survive.
thing,
Otherwise, I see a lot of them folding up.
yeah, another thing which we ran into recently is when we were building new product, we needed sensors and parts to actually build that thing, right? And we are trying to procure it from different sources. Right now, they're not available in Pakistan, but we would have to import them either from Korea or Dubai or China or stuff like that. Now we're getting that, hitting that wall that the import export is turned off. It's not happening. So we have to we found ways around that, but it would be great if there was ways we can still work on our projects like these, like especially for preventative COVID prevention, and government can help us with that.
Anam, are you back? Okay, she's gone again. All right, so the next question that I have for you is, as an entrepreneur during this lockdown period, how are you prioritizing your time? Is it a balance of work, learning, and playing? Are there any, resources that you have found that might be useful to other startup founders? Are there new revenue streams that you can possibly suggest? Things that could help other startups who are facing the same problem right now. Saba, would you like to start?
One thing that I'm personally doing quite a lot of, which I always used to say, "Se koi fayda nahi hota," is meditation. And especially because if I'm able to keep my mental health consistent through the pandemic, I think I can make sure that our work continues, our team is happy, and the kind of anxiety that everyone is dealing with. I think there's desperate need for all of our entrepreneurs to keep their mental health stable and consistent. So I would recommend that. Other than that, I would say spend time doing courses. Look at, I also run a WhatsApp group for grants and funding and learning opportunities. There are a lot of different resources that you can apply. You have so much time, you can apply to so many different things that can help you in the next 2 months or 3 months to gain certain skills. So yeah, these are some of the things that I could say.
Anyone else wants to add to that? Sibtain, Abrar, Anam, how are
Yeah,
you
sure.
spending your time, prioritizing your
So,
time during this lockdown?
yeah, finally, my kids and my wife is quite happy that I'm giving them time. So I've actually found time for them, and it's good because now I have a balance. Because even if I want to work more, there's not enough work out there actually. So because you can't go out for meetings, there is very limited access that you have with people. And Ramadan is actually a good time to spend with your family anyway, I think. So I'm doing that. That's my priority right now. Second thing is actually, I'm actually there are certain processes that we wanted to always build so that we could streamline our operations and make it more predictable rather than more on the fly. And I think this has given us the opportunity to make those things and prioritize those things that you put on the back burner. So हमने कुछ ऐसी चीजें करना शुरू कर दी है जो कि so that once things go back and we know that there is volume of business coming in, we are ready for it, we are prepared for it. Our teams, whoever we bring in, they just need to follow the process and that'll be done. So I've taken help from a person who's actually quite an expert in this. He's based out of Dubai. He also has time because obviously he's not involved in a lot of things. So that has really helped us. Then the other thing is that I've sat down with the marketing team. Started getting more involved in the marketing side of things. I used to do that before, but due to limited time, I could not really invest time into it. So now I've done that. I've sat down with teams and actually critically evaluate them. And I think they don't like me now because I've been questioning them quite a lot. I am quite critical of what they are doing. Even though they were doing great work, but still I would like to see why they were doing it. So I think the time is right now is asking the why question quite a lot, and why we're doing this, why we're not doing that, why do we have this person on board, where will we be in next 3 months, 6 months. So I think it's all about reflection, self-reflection. So I'm spending a lot of time on self-reflection these days.
Yeah, introspection, planning, maybe learning, attending a masterclass that you always wanted to but couldn't. I've done that. Abrar, Anam, is there anything you would like to add?
Yeah,
anything you're
just
doing?
to add to what Sibtain said, every parent who's working or who's an entrepreneur would now understand that how many roles do they have to be in. And if I speak of myself, I have to be a teacher now. I have to be my kids' friends because they're not exposed to any friends. So these are extra roles that we're playing right now, and we have learned how to balance it in all this time. And again, yes, self-realization, and there's a lot of empathy that we all have developed, I think, because we have been emotionally and physically probably at one stage or another, we have been exhausted due to all the anxiety and everything going on. So we have a lot of empathy towards all the fellow team members that we have. And there's one thing that I wanted to share, that when you asked about if we've cut down on the team, we recently have hired another team member because alhamdulillah, we were growing and it was getting very difficult for me to manage all of that with the current team that we had. So I'm happy and I'm glad that we somehow or the other we've actually contributed to to be helpful to another person by obviously having them on the team.
Okay, so I think we've gone through, there's a gentleman, I think it's a gentleman, Compass Company, who's written a very long message about his own experience and how they, had to pivot, and they were about to launch a product before the coronavirus. So please do go through it. He wanted to just share, and thanks all of you for sharing your experience. Tell me, during this time, because all of you are focusing really on different things, have you collaborated with other startups to make sure that this period is much more, collaboratively useful for all of you, and that you're able to provide services that you would otherwise not be able to do on your own, or add value to the work that you're doing? Is there a lot of collaboration happening right now within the startup scene?
Yeah, for me personally, guess who's helping us with the hardware side of the sensor and the actual product? Ijad Tech, Zaid Pirwani.
That's
Yeah.
great. That's very good.
So we brought him on board and we said, yeah, Zad, we need to build something like this. I have this technology, like the software side build. I need some help with the hardware side. And he was very, very helpful. He was fantastic. He's like, Abrar, you need this much is gonna cost this much is gonna cost this. And he knows everything about the hardware, Raspberry Pi, the sensors and everything we were talking about inside out. And he said, yeah, we have a 3D printer, we can prototype this. And I'm like, yeah, sure, man, definitely. And I'm sending him designs and we're working back and forth and we're gonna build on that because of him.
That's very good. That's good to know. Sibtain, anybody you are collaborating with, or there's no
Yeah,
need in the current space?
so no, we are always up for collaborations and we are looking for opportunities. So what we did was we collaborated with Sehat Kani to offer telemedicine facility to all our customers who bought insurance policies from us in the last 12 months. So we made it available specifically because of this situation, so that they have access to doctors, so they can easily take that facility. And we got a very overwhelming response. Customers who actually did not expect it, because they have already bought the policy, and we offered them for free since they were our customers. So they jumped on it and they referred more people. So yeah, this is one of the things that we did. We did that in individual insurance, and we did that in for our insurance for businesses as well, like SMEs, where we offered this facility as well. So yeah.
Saba?
Yeah, we've had a collaboration with Science Fuse. Science Fuse had a similar problem to us. They used to do a lot of interventions, science related, and experiments in schools, and they couldn't also go. So we're going to have one day where we're going to teach kids online how to build their own science bot. And that's going to be really fun for both Jai and myself to be able to teach that. So yeah, that's a collaboration we have.
Anam, are you
Yeah,
collaborating?
as I mentioned earlier, the teleconsultation portal
Yes.
that we're using is outsourced, and Instacare is a company, is a telemedicine company who we are collaborating with, and they've been really very helpful since the time we began, and the team as well.
That's great. And also I'm seeing how you're helping everybody procure masks that they need to keep themselves safe. That's a great, it's been very helpful to me particularly. And I saw how many other people, especially who had family in the healthcare area and couldn't get access to masks that they needed. I'm glad that you were able to help them. Okay, there's a question from Waqas Rashid. He wants to know, is there any funding agency alive and functional during this lockdown in Pakistan that he can probably, talk to? I don't know. Is any funding agencies right now? All I see is people asking for, whether it's Ignite, whether it's Karandas, everyone is asking for, products that you are creating to address the COVID challenge. I haven't seen anything else other than that.
Yeah, I would like to know that too, actually.
You would like to know that
Yes.
too. So nothing, nothing that any of you know of that he can, try out. I think it'll take a few months. People are just focusing on health right now, and not health, but on Corona, the COVID-19 crisis, and they want solutions for that.
Yeah,
So
I think they can still reach out to companies for the CSR funds. They are very limited, but still they can tap that also.
but aren't companies sort of also working from home, and it's very rare that they're responding right now.
That's why I said that's very small amount. That's because we also recently we had a supporting partner. We'll be starting from 15th May, inshallah, for the free teleconsultation. So
Okay.
companies who have the same vision as yours are actually being interested in such proposals.
Okay. So one last question is, how are you keeping your teams motivated, and how are you able to work with them? I know, Sibtain, you said part of your team is working from the office, 6 or 7 people, but the rest of them are working remotely. The rest of you, how are you keeping them motivated, and how easy is it to manage them from a distance?
Sending them 20 messages every day. Like, let's just ping them on WhatsApp. Pinging like, are you guys working? Okay, this is happening. Okay, this is happening. Okay, no, why not? How does this happen? And that kind of stuff going back and forth. It's been a bit difficult because there's been delays in, like, when you're sending a message and you are actually talking to your team members, rather than when you're in one place and working with them and going back and forth. It's instantaneous. But right now remotely, it takes a while. People would be doing something else, and they might not be free, and they're gonna get back to you after a while. And the timings have also changed, especially because of the Ramadan. Most people prefer to work at night till Sari, or maybe different timings. So it's been a bit rough around the edges, if I be honest about it.
Saba, how is your team coping?
We already had such a small team, so it wasn't, and since I used to travel so much earlier, we already were using all the tools, the Trellos and the Slacks. But one thing that we did immediately was that we had a daily stand-in for 15 minutes at one time. So that way we were checking in, who's working on what. Another thing was that we also had to make sure that everyone's times were different. So we had to kind of compensate. Sometimes you work on the weekend, sometimes you're working till 11 or 12, because everyone has to kind of work around each other's schedule. So overall, I think motivation dips have come and gone. However, there's always something exciting coming up, some interview coming up, some speech coming up. So we have to kind of keep on our toes even when we're sitting at home. I was planning for the biggest moment of my life very recently, and now it's going to happen right here in my own room. And so I think we have to kind of help each other, support each other, and make sure that we continue to have fun and play while we are still in the worst period of our lives, the pandemic. Yeah.
Thank you. Yeah, that's a good way to do it. Sibtain, how are you remotely managing your team?
Well, I think I've tried to learn how to communicate better. So I think it's all about expectation. It's about expectation management. Can you hear me? Hello.
Yes, we hear you. Yeah.
Hello. Okay.
We hear
So
you.
I think it's all about expectation management when it comes to communicating with teams, like what to expect from them, what kind of work you want to be delivered, when and how. And initially it was a challenge for me to communicate clearly and for them to understand what I expected of them. But then I think that is how I evolved, and the management, the core team, who are the managers who have team under them, they also understood how to be more clear in their directions that they want to give to the team. So I think everyone has gone down to detailing every single thing that they want to see, like what they want. I think that has improved the responses and caused less frustration. I think motivation has been a challenge for the sales team primarily for in my business, especially because I have a huge sales team who actually does that. And because if if they don't close business, then they are upset about it. And they like to talk to customers. They like customers who buy from them, because that's what they do day in day out. If they get no's, too many no's, it's a frustration, right? It causes a lot of pain and anxiety. So but unfortunately what we've been doing is that we've tried to make it easier for them by helping them whenever we could, to help them, assist them in their sales. And I think they found motivation somewhere else. I think staying with their families, with their home, has also allowed them to find motivation somewhere else.
Okay. Anam, you have a small team, but
Yes, so we
has
all
there been any challenge?
because one of the main team members was since forever she has been working remotely from America, so we already were used to this remote conversation and all. So yes, but a lot of use of voice notes and stuff is going on. Also, I'd like to, if you allow me, I'd like to, because everyone did mention the collaborations that they had. I forgot to mention one, and Magnus Communications and the team has been a huge support throughout. And during this current pandemic also, they facilitated us very well. They've been a huge support. So I wanted to mention that.
Absolutely. Magnus is working with quite a few of our startups,
Yeah.
and I think they've been quite active during this pandemic. I keep seeing all the messages on all social media platforms. So shout out to Ashraf Kaleem and
Yeah,
Zain
also,
Musa.
this wasn't asked for, but of course we should be thankful to
Of
Ashraf
course.
Khalid and the team.
Yeah, absolutely. So who's left? Nobody's left. Okay, there is, yeah. So this gentleman, I think it's a gentleman, Compass Company in Islamabad. He says he has a 20-minute meeting every second day, and they just talk about life and day-to-day experiences with the team, so that on how they're dealing with the current situation. So it's creating a much stronger bond between him and his team. I think that's what happens. So we've always used Slack. So the team and I have been using Slack and email and WhatsApp, and trying to make sure that we decide what we're doing during the course of any day. And I know nobody sits at the laptop from morning till evening, but as long as they have specific tasks that they know they need to take care of, I think it's all working very well. I just miss meeting everyone, as I think most of you do, because we are humans and we're social animals. So thanks very much, all of you, for sharing your experience and what you're doing and where you're at. I think a number of the startups will have learned how maybe they can cope. I hope somebody from the government is listening, so they will offer the support that startups need. I think startups maybe should be included with SMEs. The loans program hasn't worked very well for SMEs either. So because banks are asking for collateral, so startups have no collateral anyways. So I think that there needs to be special focus on making sure that the startups are also given the kind of support that they need. It is going to be 3-4 months before things start to pick up again. I hope they pick up in 3 to 4 months. But all the support that we can get during this time, whether it is, as Abrar said, if it's payment in installments, rent being frozen for the moment, and stuff like that, then it will help us all to survive. It's something that we need to do together as a country. So thanks very much, Saba, Anam, Abrar, and Sibtain, for sharing. And I hope that we can have a chat again, and that it will be under much better circumstances.
Yeah,
Thank you
definitely.
very much.
Thank you for having us.
Thank you.
Okay,
Thank you so
bye.
much.
Bye.
Have a good